It's never easy losing someone you love. The loss of a loved one is one of life's most difficult experiences. The memories you shared with them play in your mind over and over again, overwhelming you with sadness and grief. I think the hardest part of losing someone isn't having to say goodbye, but rather learning to live without them. Always trying to fill the void, the emptiness that's left inside your heart when they go. Growing up, I had a sister who was a few years younger than I. I still remember the day my mother arrived with her from the hospital. I started loving her from then on. And I still remember her first word. As she grew, we became best friends. We communicated every day. When she became pregnant few months after her wedding, we were happy that she would soon be a mother. But her doctor made a mistake during her C-section, which resulted in her death. She sent me a text message on the day she died. Later at night, my elder sister called me on phone to tell me we lost her. But my brain couldn't comprehend it. I kept asking her questions, maybe silly questions, because I could not understand what she was saying. She would be mute for several seconds and she would reply. It went on for some seconds before it dawned on me that my beloved sister and best friend is dead. I just kept screaming at the top of my voice. I cried all through the night. That bombshell opened a wound in our hearts that is still healing, even after 13 years. Very early the next day, I left for my mother's house to comfort her. But she was inconsolable. Bereavement can certainly be painful whenever it occurs, but many feel that the experience of losing a child is by far the worst because it conflicts with our life cycle expectations. A doctor once said the death of a child is usually more tragic and traumatic than the death of an older person, because a child is the last person in the family expected to die. The death of any child represents the loss of future dreams, relationships, son, daughter-in-law, grandchildren, experiences that have not yet been enjoyed. Experts say that the loss of a child leaves a permanent gap in the life of the parents, particularly the mother. There is no way that parents can lose a child and not feel that they have lost something of themselves, regardless of how much time passes or how many other children they may have. The death of a spouse is also well recognized as an emotionally devastating event, being ranked on life event scales as the most stressful of all possible losses. My mother wished she could have died in place of my sister. It seems so unnatural for a child to die before a parent. I wished the same then. I kept saying, why not me, so that she would experience motherhood. The baby was her first. She didn't get a chance to hold her baby or even breastfeed her baby. So painful. King David of Israel felt the same way when he lost his son Absalom. He said, "My son Absalom, my son Absalom. Oh, that I might have died, I myself, instead of you." It was so painful we just cried and cried and cried. Anything and everything teared me up. When King David of Israel lost his son Ammon, it was said that he wept with a very great weeping. Jacob, ancestor of the Israelites. When he was told that his son is dead, he said he was going to mourn him until he died. Naomi in the Bible, after she lost her husband and her children, she was so grief-stricken that she said she should be addressed as bitter, for her life has become bitter. Did or do you feel intense pain when your loved one died? It's natural. If you have lost someone you love, it's natural to cry because the death of a loved one opens a deep and lasting wound in our hearts. Sometimes we may feel I never even got to say goodbye. Tears are a way of releasing stress hormones that build up in our bodies. Crying facilitates the release of grief. It's a necessary part of the healing process. Do not feel that you have to hold back the tears. Feel however you have to feel. It will help you to deal with it. Do not listen to people who would tell you, be a man, you don't have to cry. Do not listen to people who give you the impression or say that you are crying or weeping too much, maybe in comparison to someone else who also lost a loved one. Do not feel ashamed of your tears. Jesus openly shed tears of grief without any apparent embarrassment. Tears may flow without much advance warning. There is no timetable for how long you will grieve. The length of time is different for each person. For most people, their mourning period is a long process and it can take years. Do not bottle up your feelings. Repressing your feelings can be harmful. I felt anger at the doctors and nurses in the hospital she was operated on, and also the doctors and nurses in the hospital where she was referred to. We had a feeling that she wouldn't have died had the doctors and nurses did a good job. I felt anger at some of my relatives who exhibited insensitivity. Anger can be another symptom of grief. It may be anger at doctors and nurses, feeling that they should have done more in caring for the deceased. Or it may be anger at friends and relatives who, it seems, say or do the wrong thing. Or it may be anger at the departed one for neglecting his health or his safety. If you felt this way or presently feeling this way, know that such anger is a symptom of grief from the death of a loved one. Some feel sad for what they did or said to the deceased, or the relationship between them. In my case, my family felt if only the doctors in the first and second hospital did a good job, maybe she wouldn't have died. Did you feel? If only I had made him go to the doctor sooner, or made him see another doctor, or made him take better care of his health or safety. If only I could see and talk to him one more time. If only I did this or that, he wouldn't have died. And for some, the grief is so much for them because of guilt. Feeling that not enough was done to help, or that important things were left unsaid. Dwelling upon all kinds of if-onlys and guilt feelings will not change anything. You cannot return to the past and change anything. Someone may feel that some neglect on his part contributed to the death of his loved one. Realizing that guilt, real or imagined, is a normal grief reaction and can be helpful in itself. Here again, do not necessarily keep such feelings to yourself. Talking about how guilty you feel can provide a much-needed release of pain. Now think about this. Did you intend for your loved one to get sick or be in harm's way and die? Of course not. Then are you really guilty of causing that one's death? No. During my grieving, mourning period, I lost appetite in life. I just wanted to die. I lost appetite for food. I stopped following many of my everyday routine. My grief was so much I became severely depressed. I was never happy. I became a crybaby, crying over anything. Always tearing up. And this went on for years. I lost so much weight. My severe depression led to memory loss. At the initial stage, my memory loss was so bad that I could not remember things that happened a few days earlier. Many memories from my elementary school days, high school days and higher school days and afterwards has been erased from my memory because of the intense pain from my beloved sister and best friend's death. I'm still so very forgetful. My mother never recovered from my sister's death. She would always ask how she would continue to live without her baby. My mother lost a lot of weight and she aged so quickly following the death of my sister. And she always had fresh bout of pain on every anniversary of my sister's death. My mother died 4 years later. Another deep lasting wound in my heart. Grief or bereavement releases the hormone cortisol in reaction to stress that breaks down tissue and, in excess, can lead to collagen breakdown and accelerated aging. When you are grieving, you might not feel like eating, and you might not follow your everyday routines. You could notice constipation, diarrhea, nausea or stomach pain. Grief can impact your immune system and make you more susceptible to disease. It is very common to feel tired or exhausted when you are grieving. There are many reasons why you may feel tired, especially if you were caring for the person who died. Strong emotions along with all the practical things you may have needed to do after they died, can also leave you feeling exhausted. The heartbreak of grief can increase blood pressure and the risk of blood clots. Intense grief can alter the heart muscle so much that it causes broken heart syndrome, a form of heart disease with the same symptoms as a heart attack. For people who are grieving, nighttime is often the most challenging time of day. They are exhausted from trying to hold it together, and darkness tends to lower their mood and usher in intense feelings of anxiety and despair. Acute grief may include memory loss and insomnia, extreme fatigue, abrupt changes of mood, flawed judgment and thinking, bouts of crying, appetite changes, with resultant weight loss or gain. A variety of symptoms of disturbed health, lethargy, reduced work capacity, hallucinations, feeling, hearing, seeing the deceased. Lack of energy, loss of appetite, headaches. Behavioral changes, increased frustrated and angry episodes, increased isolation, inability to sleep or sleeping much more, inability to concentrate. Emotional changes, feelings of hopelessness, helplessness, sadness, numbness, fear, guilt, anger and anxiety. Depression is usually the longest and most difficult stage of grief. Depression can be a long and difficult stage in the grieving process, but it's also when people feel their deepest sadness. Those are physical effects of grief on someone who has lost a loved one in death. It also includes irrational resentment of one's spouse in the loss of a child. I have watched many crime and investigation programs where couples divorce after the death of their child. That's sad. One would think that the death of a child would bring the couples closer, but in most cases it doesn't. The death of a child takes a toll on the couple, affecting their relationship, sometimes leading to a divorce. The problem is that the grieving mother has the impression that her husband may not feel the loss as she, or the husband may feel that his wife is mourning too much and thereby neglecting him. It is vital that husband and wife realize that they are suffering together, although in different ways. If the husband hides his grief, pain, his wife may think he is insensitive. So share your tears, thoughts, and embraces. Show you need each other as never before. A couple who lost their child in death said what they, the man and the wife, did to prevent divorce. The wife said, "My husband and I heard of other couples that got divorced after losing a child, and we didn't want that to happen to us. So anytime we felt angry, wanting to blame each other, we would talk it out. I think we really grew closer together by doing that." They grew closer by talking their pain out and avoiding blaming each other. This couple came to understand that even though the husband and his wife may be sharing the same loss, each may grieve differently at his own pace and in his own way. People react to grief in very different ways. Some people find they cry very frequently and may be overwhelmed by the strength of their emotions. Others may feel numb for some time or feel unable to cry. Some people experience swings between extremes. Grief can make one feel very lonely, even when one have loved ones around. Sharing your sorrow with others who have experienced similar losses can help. Take care of yourself and your family. Eating healthy foods, exercising and getting plenty of sleep can help your physical and emotional health. Talking about your feelings to a true companion who will listen patiently and sympathetically can bring a measure of relief. And if the listener is another bereaved person who has effectively dealt with his or her own loss, you may be able to glean some practical suggestions on how you can cope. Communicating your feelings can help you to release your grief. Another helpful tip in coping with the death of a loved one is to express your feeling in writing and read over what you have written. Accept help from friends, that may be how they show how they feel. Find relatives and friends who can understand your feelings of loss. Join support groups with others who are experiencing similar losses. Express your feelings. Tell others how you are feeling, it will help you to work through the grieving process. You may need periodic checkup by your doctor. Postpone major decisions, if possible, wait for at least some time until you are thinking more clearly. A few weeks after the death of my sister, one of my sisters turned in a resignation letter to her company. And it was a high-paying job. Thankfully her bosses understood that she did it out of confusion and pain of her sister's death. So they gave her time off work, until she can think more clearly. Be patient with yourself. Grief often lasts longer than people in general realize. Yearly reminders of the lost loved one may renew the pangs. Special pictures, songs, or even smells can trigger the tears. So be patient with yourself. Avoid using medication or alcohol to cope with your grief. Any relief offered by drugs or alcohol is temporary at best, and may become addictive and delay the grieving process. Get back into a regular routine. Getting back to your normal routine will do you a lot of good. Some bereaved ones are afraid to let go of the intense grief, believing that it may indicate their love for the deceased one is diminishing. That simply is not the case. Let go of the pain. Do not be afraid to let go your grief. Do not be unduly anxious. You may find yourself worrying, what will become of me now? Take one day at a time. Living more on a day-to-day basis really helps me, said one widow. Do not hide your pain. Try socializing. If you feel like talking about your beloved who is deceased, please do. People say time heals wound. It really does help one manage the pain better. So be patient with yourself. The passing of years will help you manage your pain better. Do not underestimate the power of prayer. And may the resurrection hope help you bear the pain of the death of your loved one. I pray this video comforts and helps you deal with your grief. Best wishes. Love from Mrs. Jim.